in South Africa.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والعاقبة للمتقين والصلاة والسلام على رسوله الكريم سيدنا محمد وآله وأصحابه أجمعين برحمتك يا أرحم الراحمين. All praise due to Allah, the Lord, cherisher, nourisher, sustainer and master of the universe, the most gracious, the most beneficent, the most merciful. Ya Allah, it is only you that we worship and it is your guidance that we seek. Ya Allah, keep us on the straight path. Ya Allah, shower us with your choice of blessings. Ya Allah, shower us with your mercy. Ya Allah, guide us. Greetings, salam, salutations on our beloved Nabi Muhammadur Rasulullah sallallahu alaihi wasallam. It's time for Medical Files, brought to you by the Islamic Medical Association of South Africa and hosted by myself, wabarakatuh, and we welcome our listeners on Radio Al Ansar, CII Radio, Voice of the Cape, Radio 786, Sirius FM, Radio Islam, and IFM Port Elizabeth, and all listening to us on audio streaming and other platforms. Our topic for discussion this evening is epilepsy, and our very special guest is Dr. Hussein Parak, a neurologist who is practicing in Pietermaritzburg. Dr. Hussein Parak, assalamu alaikum wa rahmatullahi wa barakatuh, and jazakallah khair for joining me in the program this evening.
Wa alaikum assalam wa rahmatullahi wa barakatuh. Jazakallah khair. Brother Faisal, it is always a pleasure to join you.
The pleasure is mine, Hussein. Now, our topic for discussion is epilepsy. Dr. Parak, what is epilepsy and how is it different from other neurological conditions? Or rather let's consider what is epilepsy, I think.
Right. So, when we talk of neurological conditions, we're talking of conditions or diseases that affect the nervous system. And the nervous system comprises what we refer to as the central nervous system, made up of the brain and spinal cord, as well as the peripheral nervous system, which encompasses the nerves and the muscles that move our limbs and control and are responsible for our senses. So epilepsy is a disease of the brain, right? And it is a disease of the brain which is characterized by the tendency or by an enduring predisposition to have recurrent, unprovoked seizures. That is what is epilepsy in a simple definition or nutshell.
And then when you said unprovoked seizures, what are seizures then?
Right. So seizures refers to a phenomenon where there is a sudden excessive electrical discharge of a group of brain cells. So remember, our brain cells do communicate with one another using sort of electrical currents.
Okay.
But when this discharge is sudden, excessive, not synchronized, it's what results in a seizure.
Now, do you get different types of seizures, or how many different types of seizures you get? How do they manifest themselves? The different seizures.
Right. Good question. So seizures, we can broadly divide them into those which are what we refer to as generalized and those which are focal. So what do we mean by generalized seizures? A generalized seizure is something occurs when the seizure activity, that is the abnormal discharge, occurs in cells of the brain, in the majority of the brain on both sides. So right from the onset, both sides of the brain are involved in the abnormal discharge. Characteristically, it would result in loss of consciousness right at the onset of the seizure, or at least in impaired awareness. And in this, what we would refer to, sometimes some children can have absence seizures, where they just suddenly become unaware and stay in space, often mistaken as daydreaming.
Okay.
So in contrast to, and then the other type of the generalized seizure would be where the person would lose consciousness and have what is probably known as the prototype of tonic-clonic jerking, or a grand mal seizure, where the muscles or the limbs stiffen and then they jerk. Then there are also focal seizures, where the abnormal discharge begins in one particular area of the brain.
Okay.
Now, depending which area of the brain the seizure commences will determine the type of symptoms that the person may experience. So, for example, it might just be simple shaking or jerking of a limb. Sometimes it might just be an abnormal sensation of a limb. It might be the person starts seeing something differently, hearing some noises. Sometimes they just experience fear or a abnormal feeling in the abdomen. So depending, again, it can be very variable. And then this abnormal discharge can then spread to involve other areas of the brain. So right in the beginning, there would be a certain symptoms, and then later on, more symptoms can develop. So for example, let's say the person first will have jerking of the limb, then later on they would become unresponsive. Eventually they would fall down to the ground and have what looks like a grand mal seizure, because the focal seizure can actually spread not just to brain cells on the same side of the brain, but both sides of the brain, and then it eventually resembles a generalized seizure. So this is what used to previously be called as a secondarily generalized seizure.
So when you use terminologies like seizure, me as a layperson, is that what I call an epileptic fit? Is that different? I'm talking about a layperson.
So yes, usually it's called a fit or a convulsion is a seizure, but it's a single seizure does not make the diagnosis of epilepsy.
Okay.
So remember right in the beginning I mentioned unprovoked seizures. Why did I use the word unprovoked seizures? Because under certain situations we can actually provoke seizures. For example, somebody who's going through withdrawal of a certain drug, most commonly alcohol. In such a case, one would be having what we refer to as a provoked seizure. So in such a situation, that's even if one has a few seizures of this nature, always in association with withdrawal, it does not equal a diagnosis of epilepsy. Another situation in which a person can have a seizure is if the blood sugar is very low. So hypoglycemic seizures. So those are provoked seizures. So when we're referring to epilepsy, we're referring to unprovoked seizures and a tendency to have these on a recurrent basis.
So to understand you correctly, you are saying if there are no triggers that trigger off the seizures, then it's unprovoked. Is that correct? Or
Correct.
are there any other common triggers?
Yeah, but so those are different. Those are certain special situations, but we do also have triggers in terms of what might lower one's what we refer to as seizure threshold.
Okay.
So what are these sort of triggers? These things can be sort of like sleep deprivation, having an intercurrent illness, being dehydrated. So these are also sort of what we refer to, they lower one's seizure threshold. So in a person who has epilepsy, if they're going to be exposed to such triggers, then they are more likely to have a seizure. It may not happen all of the time, but it just might lower the threshold and it might trigger off a seizure.
Just to remind our listeners, you are listening to Medical Files, and this is an interactive program. Our topic for discussion is epilepsy, and our special guest is Dr. Hussein Parak, a neurologist practicing in Pietermaritzburg. If you have any questions for Dr. Parak, you may on epilepsy, you may forward them to us via WhatsApp on 060 904 1056. That's 060 904 1056. Now, Dr. Parak, talking of the seizures, how long do these seizures last?
So generally, when we ask patients how long the event lasts, most people probably don't keep an exact time at that time, because, when something quite emotional is happening, it can seem like a lifetime. And people will generally tell you 5 minutes, 10 minutes. However, in reality, when we witness seizures and we time them, most seizures generally last less than 2 minutes.
Okay.
Right? And more often, they're probably less than a minute. So they may last anything from a few seconds up to a few minutes. Yes, in certain circumstances, the seizure can be more prolonged, as we'll probably discuss later, in a more serious situation, and that would obviously then require urgent treatment.
Now, obviously, in a minute, if somebody gets a seizure in your presence, there's nothing you can do about it. Well, very little, especially if you're a layperson. If one just leaves the person who's having a trigger, having a seizure, what's the consequences of that? In other words, if it's left unattended, what happens?
So most seizures will abort by themselves.
Okay.
However, if you do witness a seizure, right? So the principle is to, as with any medical condition, is to avoid any further harm.
Okay.
So assess, where is this person having the seizure? Is it on the middle of the road? Is it close to an object which they might strike and then get injured? So the idea is to ensure safety of the environment firstly. If they're on the road, perhaps pull them over to the side, make sure there's nothing in which the person might strike themselves and injure themselves. And generally the seizure would abort, and then it's advised to lie the patient on their side in what we refer to as the recovery position.
Okay, there's a question that's come through. It says, what is a typical seizure and what are examples of such seizures? It's because it's atypical seizure. ATYPICAL.
Atypical seizures.
Atypical,
Okay.
yeah.
So
it's not a dot typical, it's atypical. Yeah.
So, I mean, atypical would, I think the public is more aware of the type where a person has the stiffening of the limbs and the jerking of all four limbs after having fallen to the ground. But as I said, seizures can take various different forms. In absence seizures, for example, is just a staring episode. Then we can have seizures of focal seizures with impaired awareness, where a person just loses awareness of the people around them and the environment. They may even continue to do things that they're busy with, and it would appear as if they are fidgeting. They might just have lip smacking, might just blink their eyes. So then there are other types of seizures where a person will just suddenly lose tone and fall down to the ground. So certain seizures may a person just becomes very emotional. These can be seizures. So these are perhaps for the public with what would be more sort of as the atypical seizures.
Yeah, that question came from Brother Yusuf. Jazakallah khair for that question. And how would you diagnose a seizure? What are the diagnoses? I mean, I should have come to the symptoms before that, but let's go to the diagnosis.
So the diagnosis is based mainly on the history. And often the individual having the seizure cannot properly recount the details because they may not have a proper recollection of it. They may not be aware of what they're doing. So it's key for that somebody who has witnessed the seizure to accompany the individual having the seizures for the consultation to provide what we would call an eyewitness history. So key is the history. Together with the history is the physical examination, although in most instances of epilepsy, the examination will not reveal any abnormal findings. Following the history and the clinical examination, the doctor will then order certain tests.
Okay.
And these tests may include certain blood tests, imaging of the brain, either via a CT scan or an MRI scan, and a special test referred to as an electroencephalogram.
Okay.
Right? EEG for short. Now, I think we're all familiar with the ECG, electrocardiogram.
Exactly.
Right? Which is simply an electrical recording of the heart wave, heart activity.
Okay.
So an EEG is an electrical recording of the electrical activity of the brain. Seizures typically have certain unique discharges or a type of activity that can be detected on the EEG. And if this is noted, then it would help to confirm, firstly, the presence of seizure activity or an epilepsy, or in certain times, depending on the pattern, even an epilepsy disorder. So this test, often it involves the placement of electrodes on the scalp. It may be done over a period of about, and the recording may be taken over a period of about 20 minutes. But in many instances nowadays, we're doing prolonged recordings where the electrodes are left on the scalp for 24 hours.
Okay.
And in certain instances, it's actually left on the individual for a few days.
So one has to be admitted to hospital for this?
If one is having the extended recording.
Yeah. There's a question that comes from a brother Mac Fazluddin. Says, Assalamu alaikum wa rahmatullahi wa barakatuh. Very interesting topic. One of my employees has been diagnosed with crystallization of the brain. He's had a few seizures that seem to be getting more frequent. Should the employee be medically boarded, or is this treatable with meds? Jazakallah khair.
I'm not sure what's meant there by crystallization, or is it calcification?
The word is crystallization here. It might be calcification if that's more appropriate.
Yeah, so I'm not. Yeah, crystallization. I'm not familiar what they're actually meaning, but it depends. In certain, patients are investigated with a brain scan to see if there is a disorder that's causing it. But in very many instances of epilepsy, there's no particular cause that's identified. Either way, the person, whether a cause is identified or not, they still need to have treatment. Treatment in most instances, as we'll discussed in the program, is medical, but there are also certain other modalities of treatment that are becoming available.
So in a case like this, should they be warded off or continue with the treatment? It is a treatable thing.
It is treatable. It's not necessarily that a person be boarded off soon as a diagnosis of epilepsy is made.
Jazakallah khair. Just remind our listeners that the number for your questions via WhatsApp is 060 904 1056. Now, Dr. Rendry, Dr. Parak, my apologies. Who treats epilepsy? Who do I go to?
So neurologists typically specialize in the treatment of epilepsy. However, other doctors, including general practitioners and physicians, are able to treat the condition once it has been diagnosed.
So you can go to your GP to have this thing treated?
Generally, the follow-up treatment. Often a GP would refer the patient initially to a specialist for confirmation of the diagnosis and the treatment plan. But patients thereafter can be followed up even by the general practitioners. Often the general practitioners will be in discussion with the specialists regarding any treatment adjustments and so on.
Let's go to the causes of epilepsy. What are some of the known causes of epilepsy, doctor?
So varying causes of epilepsy, but it includes things such as head trauma. This can be experienced during the birth process as well. Brain injuries. There can be brain tumors. There can be infections. There can be abnormal development of the brain. Now, this is something that we sort of increasingly recognize now with the advancements of neuroimaging. For many years, we only had CT scan. And then late 90s, early 2000s, that's when MRI became more common. And we're noticing subtle areas of abnormal brain development, which are actually the foci from which seizures originate. And obviously, as imaging becomes more advanced, more such abnormalities will be detected. We've also now discovering genetic causes of epilepsy. But however, as I did mention earlier, very often no cause is actually identified.
So when you refer to genetic, if one's parents or grandparents had it or one's siblings have it, so the chances of one picking it up is quite great?
So it is increased, but it is not 100%. So when it comes to all genetic conditions, there are conditions which have what we refer to as absolute or 100% penetrance, where it will definitely be passed on to the offspring. And there are conditions which may not have 100% penetrance. But in general, if one has a first degree relative who does have epilepsy, then there is an slightly increased chance or risk compared to the general population. And it's thought to be in a degree of approximately 6 times more that one may also develop epilepsy.
And let's talk about treatment, Dr. Parak. How is epilepsy treated?
So, as I alluded to earlier, the mainstay of treatment is medical treatment. And when one decides on what treatment to use, one needs to make a very individual decision. It includes the profile of that individual, the gender, the age of the person, the type of seizure the person is experiencing, and the type of lifestyle that person expects to lead. So there are various different medications that are available on the market. The traditional ones, some of the names which our listeners might be familiar with would be phenytoin, valproic acid, carbamazepine, known as Epilim or Tegretol. Those are the older ones. They are effective. there are quite a few newer ones that are now also available. And in general, the advantage over the older drugs is not so much in terms of better seizure control, but they sort of more tolerable and have less side effects,
Okay.
right? But then they are also more costly.
Mhm.
So, generally, your doctor would choose a drug that would be most appropriate for that particular individual according to the type of seizure that that person is having.
Just to remind our listeners that doctors and guests on the Medical Files program will help you with any medical problems you pose by giving you advice on air. However, they do not have your full medical history and have not examined you. Please verify the advice given to you on air with your regular doctor who knows your medical history, your allergies, etc. Neither the doctors, nor the relevant radio stations, nor the Islamic Medical Association of South Africa will take any responsibility for any adverse reaction caused by the advice given on Medical Files. It's time for us to take a short break. We will be taking a break for the Isha Azan. It is time for the Isha Salah in the Durban area. So in the other areas, that are listening to us, please take note of the time of Isha Azan in your area. After the Isha Azan, we'll take a short ad break and we'll continue after this. Dr. Parak, we'll continue after this, inshallah, and let's take it from there.
This Adhan is sponsored for the Isale Sawab of Marhum Muhammad Farooq Latib and all Marhumin. May Allah subhanahu wa ta'ala grant them the highest abode in Jannah. Ameen.
Allahu Akbar, Allahu Akbar, Allahu Akbar, Allahu Akbar. أشهد أن لا إله إلا الله، أشهد أن لا إله إلا الله، أشهد أن محمدا رسول الله، أشهد أن محمدا رسول الله. حي على الصلاة، حي على الصلاة، حي على الفلاح، حي على الفلاح. الله أكبر، الله أكبر، لا إله إلا الله.
اللهم رب هذه الدعوة التامة والصلاة القائمة آت محمدا الوسيلة والفضيلة والدرجة الرفيعة وابعثه مقاما محمودا الذي وعدته وارزقنا شفاعته يوم القيامة إنك لا تخلف الميعاد.
This dua brought to you by Simplex Radio, South Africa's leading retailer of appliances, car sound and home theater systems.
These surahs after Azan are brought to you by Amina's Wonder Spice and Wonder Dates, 9 Peters Road, Springfield, Durban.
بسم الله الرحمن الرحيم قل هو الله أحد الله الصمد لم يلد ولم يولد ولم يكن له كفوا أحد.
Having a clean, comfortable home is every homeowner's pride. That's why Khan's Chemicals have developed and manufactured prime yet affordable quality household brands Starlight, Miracle Mum, Exterminate, and Angie to care for your home and family. With a wide range of fabric softeners, dishwashing liquids, bleachers, and all-purpose cleaners, pine gels, bubble baths, and much more, Khan's Chemicals ensures your home remains our number one priority. For sales and other inquiries, call 011 933 4021. Khan's Chemicals, cleaning your home the way you want.
Welcome to Simplex Radio. Visit our showroom for the full range of car audio. Our TV department carries top brands with quality LED panels, full HD to Ultra HD, and now the experience of Super Ultra HD. Visit our theater rooms and transform your home with brands like Onkyo, Integra, Denon, Boston Acoustics, Yamaha, and more for quality audio visual experience. Now available, full range of home appliances. A one-stop shopping experience. Call 031 306 4029 or Kenilworth Park, 202 Brickfield Road, Overport. Simplex Radio, the name you can trust.
With 49 years of motoring experience, Metro Car Sales Peter Maritzburg, your largest independent dealer, keeps you rolling to your next destination. As an approved dealer with all major banks, we offer in-house finance arranged within the hour, tailored to your needs. Visit us today at number 1 Boshoff Street, Peter Maritzburg, or online at metrocars.co.za. Metro Car Sales, your number 1 dealer in wheels, proudly serving you since 1976.
Al-Ansar International.
You listen to Medical Files, brought to you by the Islamic Medical Association of South Africa and hosted by myself, Faisal M.J. Sulaiman. Our topic for discussion is epilepsy, and this is an interactive program, and you can forward to us any questions that you might have for our special guest, Dr. Hussein Parak, a neurologist practicing in Peter Maritzburg, and these questions may be forwarded to us via WhatsApp on 060 904 1056. Now, Dr. Parak, a question has come through from a listener, says, Assalam Doc, what is the best remedy for seizures? Because my grandson got this disease for a couple of years, have to take his medicine every day, so he can he be cured? Really worried, please let me know. Jazakallah.
Yes, so it's important that the medication be taken every day, and also if one is taking it twice a day, to try to stick to the same times. And epilepsy can be what we say resolved. And we don't use the term cured, because once a person has a seizure, then they're at higher risk than the general population of having a recurrence. But yes, they can be what we refer to as epilepsy resolved. And this is when a person does not have seizures for several years without taking treatment. But in order to first reach that state, one needs to be seizure-free. For most instances, we would say a period of at least 2 years. And then depending on the type of epilepsy that individual has, whether it's due to no structural abnormality or not, the doctor will make a decision as to whether treatment can be weaned off. So it has to be withdrawn slowly. It can't just be terminated. But coming back more to the listener's question, the best treatment remedy is the anti-seizure medication initially, and which depends really on the type of seizures that her grandson has.
Another question comes to Dr. Parak is, can Dr. Parak say something about Keppra tablets and what kinds of epilepsy it is used for?
So Keppra is the trade name for the drug levetiracetam. So it is one of the newer drugs that's available. It doesn't require very intense monitoring of the drug levels. It's fairly effective. It can be used for both focal onset seizures as well as generalized seizures, probably better for focal onset seizures. So it is a drug that's sort of considered to have less side effects than the older drugs. So it is being quite widely prescribed nowadays.
Now, doctor, you did allude earlier to medical treatment, medicines that are used for treatment. Now, how well does medication work?
So, with medication alone, we can hope to treat at least more than 50% of our patients, up to about 60% of patients will achieve seizure freedom.
Okay.
If a person does not achieve seizure freedom with the first medication, then what is recommended is that an alternative drug be used. So, for example, let's just say a person was commenced on Epilim. If it fails, then one could commence Keppra.
Okay.
In the real world, what happens more commonly is that a second drug is just automatically added.
Okay.
Okay. Although the actual method should be an alternate monotherapy. Sometimes we skip this part, depending also on the type of seizures and clinicians' experience. They would think that maybe this individual is going to need more than one drug, then they would just add on a second drug. So after adding on a second drug, one will get a few more patients under control, say an additional 5%. But then once one adds on a third, fourth drug, very few additional patients will become completely seizure-free. And that's when we refer to patients as having refractory epilepsy. So they're on 3 drugs and they're still having seizures.
Now, we've taken the drugs, we're still having seizures. Are there any other modalities besides medicine? Any other modalities of treatment?
So that's where we can consider now epilepsy surgery, depending.
Epilepsy surgery?
Yes.
Okay.
So this, now earlier in the program, we mentioned that sometimes individuals are admitted into the hospital for a few days of monitoring.
Okay.
So this is where they would have an EEG attached to them, say for a period of about 5 days. And at the same time, they would also have a video of them 24 hours a day.
Okay.
Very often, the medication is tapered off prior to going into this, what we call long-term monitoring unit. And the idea is to provoke a seizure.
Okay.
And actually video it, capture it, and at the same time, whilst it's captured, to see how it's manifesting, and with the EEG leads in place, see which part of the brain is first affected.
Okay.
And if on that area, with certain areas of the brain, it shows an abnormality, then one can possibly then consider doing surgery by removing the seizure focus.
Okay.
Obviously, this has to be done in a specialized epilepsy unit. It's not an easy decision taken lightly.
Of course.
But there have been very successful outcomes following epilepsy surgery as well. And this is a field that is growing.
And is this facility available in South Africa?
Yes, it is available in a few specialized centers.
It looks like quite a serious surgery.
Yes, the selection of the patient is of crucial importance, and it needs to be done by a surgeon who has experience or has gone for some training in epilepsy surgery.
Now, what are some of the precautions that one could take if one's suffering from epilepsy?
So, in general, a person should be aware that they should not be in a position where, if a seizure were to suddenly strike them, that they would be in serious danger. So, for example, working from heights, working with dangerous machinery and equipment. So, in terms of occupations, we generally advise people not to work at heights or with dangerous machinery and equipment. When it comes to driving, this is often left to the discretion of the treating doctor.
Okay.
In general, if the person's has a low risk of seizures or the seizures are relatively well controlled, we would allow them to drive.
Okay.
However, following the first episode of a seizure, and if a person's not on treatment, because remember we said you need 2 seizures to be diagnosed with epilepsy,
Okay.
we would advise a period of up to 6 months of no driving.
Okay.
So, and also after seizure is first, or even after epilepsy is first diagnosed, at this stage we don't know how frequent the seizures are going to be. would, for an initial period, advise no driving to make sure that the seizures are well controlled. The one qualifier to this driving is that a person's not in South Africa allowed to possess a professional driving permit if they have epilepsy.
Okay.
So, for example, drive the bus or ambulance.
Okay.
So,
Okay.
but privately, if according to the treating doctor, the risk of a seizure is low, then they are allowed to drive.
Mm-hmm.
And then other simple things is not to swim alone. Be careful of sailing if you're doing it alone. But if you are in company, then it should be fine. So a person with epilepsy is actually allowed to carry out most activities without restriction.
Play sport?
Yes, why not?
Okay. Okay. No, it's important because, especially playing soccer, etc., etc.
Yeah, except for sports that would involve blows to the head.
No contact.
So I wouldn't advise contact sports like
Okay.
karate or boxing.
Okay. All right. It's time for us to take another ad break. But on the other side of this ad break, Dr. Amadou, discuss whether women with epilepsy can have children and epilepsy in pregnancy, etc.
Looking for top quality tools and hardware at unbeatable prices? WhatsApp us at 081 450 6082 or shop online at hyperhardware.co.za for fast, reliable service. We deliver nationwide. It's official. Checkers Foods Kawi Park is our first food store with a halal butchery, bakery and deli certified by NIHT, the National Independent Halal Trust. This will ensure high standards and ethical practices across our butchery, bakery, and deli from farm to table. So visit Checkers Foods Kawi Park for an exceptional shopping experience that keeps getting better and better.
Transform your space with Blinds on Kenilworth. From sleek modern blinds to timeless curtains, wallpapers and soft furnishings, we bring elegance and style to your home or office. Customize your look with premium designs that match your vibe. Call us today on 084 511 8099 or 081 737 3394. Blinds on Kenilworth, where style meets sophistication.
This segment is brought to you by Kenfield Auto, your RMI approved service and repair specialist. 236 Brickfield Road, Overport. Kenfield Auto.
Bismillahirrahmanirrahim. ربنا ولا تحملنا ما لا طاقة لنا به واعف عنا واغفر لنا وارحمنا أنت مولانا فانصرنا على القوم الكافرين.
Car won't start?
Kenfield Auto.
Noisy brakes?
Kenfield Auto.
Due for a service?
Kenfield Auto. Kenfield Auto, the answer to all your car problems. Your service and repair specialist for your VW, Audi, Suzuki, Toyota, or just about any vehicle. Kenfield Auto, your RMI and insurance approved workshop to handle them all. 236 Brickfield Road, Overport. Call us on 031 207 2399. Kenfield Auto.
Would you like to give Sadaqah 365 days a year? You can with the Al Imdad Foundation's Daily Sadaqah program. Donate as little as R1 a day for a month for each member of your family, up to any specified amount, and receive monthly feedback on where your contributions have made a difference. Visit alimdad.com and download your Daily Sadaqah debit order form or call 0861 786 243 for more information.
Radio Al Ansar, Durban, South Africa.
You listen to Medical Files, brought to you by the Islamic Medical Association of South Africa and hosted by myself, Faisal M.J. Suleiman. Our topic for discussion is epilepsy and our very special guest, Dr. Hussein Parak, and a neurologist that practices in Pietermaritzburg. This is an interactive program. If you have any questions on epilepsy, you may forward them to us via WhatsApp on 060 904 1056. Now, Dr. Parak, there are a few questions that have come through from listeners, but before we just tackle those questions, I did say before the ad break that I'd like to deal with women and epilepsy. Firstly, if a woman suffers from epilepsy, can she fall pregnant, or should she fall pregnant?
Right. So it depends on obviously how well controlled the epilepsy is, and if there are any other medical conditions that may harm her or endanger or place her in extra danger during the childbirth. But per se, a woman who has epilepsy can fall pregnant.
Okay.
So it's not a contraindication. I think there's a slightly increased risk that a woman who has epilepsy, that the baby then may also be affected with it, but it's not always the situation.
Mm-hmm.
So the concerns with pregnancy and epilepsy is twofold. One is the medication that they are using,
Mm-hmm.
that it may develop, that it may harm the developing fetus.
Okay.
So there are certain medications which may cause more harm than others. So it is therefore advisable that a woman who has epilepsy and wishes to fall pregnant, they consult with their doctor well in advance of the pregnancy,
Mm-hmm.
in order to ensure that they are on a medication that is safe for pregnancy. It's actually too late to change medication during the pregnancy itself.
Mm-hmm.
Because when medication is changed during pregnancy, then often during the change of medication, the seizures may become less well controlled, and having seizures during the pregnancy is then also harmful to the baby. So the two issues are, one is the medication and side effects, and two is the effect of seizures on the developing fetus during the pregnancy.
So does the lady visit her gynecologist, or does she go to her neurologist to get this particular information or advice?
So generally, it's the neurologist who would advise which medication to be on
Mm-hmm. Mm-hmm.
during the pregnancy. So nowadays, we're trying to avoid using medications that were contraindicated during the pregnancy. So Epilim, for example,
Mm-hmm.
old drug very widely used, is actually not advocated for use during pregnancy.
Okay.
So it's not recommended to use Epilim in females of childbearing potential.
So obviously it's a case by case situation, and before you fall pregnant, contact your doctor so that you can get the relevant advice.
Yes, because one doesn't want to just change medication and be left with an increased frequency of seizures.
Absolutely. And one of the questions come through, Doc, is at what stage do you call a doctor or an ambulance when somebody's having a seizure?
So we mentioned that most seizures will self-abort within 2 minutes, and all that is really required is to place the patient in a recovery position and provide them with reassurance. However, if a seizure is prolonged and lasting more than 2 minutes, going now towards 5 minutes, sometimes it goes on for half an hour.
Okay.
But generally, once you see a seizure lasting more than 2 minutes continuously, jerking, not stopping, or a patient's not regaining consciousness and has another seizure,
Mm-hmm.
then this means that the patient might be going to a condition that we refer to as status epilepticus.
Okay.
Now, this is an emergency situation in which the onlookers or bystanders should call for medical help, because what is required in this type of situation now is medication to be administered intravenously, that
Mm-hmm.
is directly into the bloodstream,
Mm-hmm.
to abort the seizures.
And is there any time limit for this, or? Yes.
Well, the earlier the medication is administered, the better.
Another question that's come through is that we have been told that if somebody's getting an epileptic fit, and I'm reading as it's come through, you normally give them a key in the hand or put a key in their mouth. Your thoughts on that?
So there's no evidence that doing something like that is going to help abort the seizure,
Mm-hmm.
and there's no physiological rationale as to why it would help the seizure.
Mm-hmm. Mm-hmm. Okay. So,
And in fact, placing objects in the mouth can cause more harm to the person having the seizure
mm-hmm.
than any benefit.
Okay, there's another question that comes to says, Salam, doctor, please help. At our high school, amongst our local students, ancestral callings have become more common, almost one every week. It looked like the students were having a fit to me. Please advise. NB only. Okay, yeah, please advise. I'm not going to read the other part.
Right. So there are conditions that can resemble seizures but are not epileptic seizures. And this can sometimes be born out of a person's subconscious. We refer to them, a term that's used often is pseudo seizures
Mm-hmm.
or psychogenic seizures. right? Or non-epileptiform seizures, a more neutral term. These individuals require assistance. They should not just be dismissed, but it can be sometimes tricky to diagnose, especially for non-specialists. And oftentimes these patients will be treated with anti-epilepsy medications when in fact that's not going to help them, and they actually require treatment of the underlying problems, which might be more psychological in origin.
They should be referred to a psychologist or a psychiatrist.
Yes, so such patients we co-manage with a psychologist or a psychiatrist.
Because the listener does say that these are ancestral callings. I'm just trying to get the word. Yeah, these are ancestral callings, she says, and they're more cultural issues.
Yes, so sometimes they are in a cultural context.
So call your doctor because in case it's a seizure, but also get to a psychologist.
Yes, you don't want to just dismiss somebody, and sometimes the distinction is difficult to make actually.
Yes.
And I think what can complicate the issue is that some patients with epilepsy can also have non-epileptic episodes.
Okay.
So both conditions can exist together.
Okay. All right. This is now more an Islamic point of view question, but I'll forward it to you. Salams, how are you? Can you marry someone who is born epileptic from a Muslim point of view, and can she have a normal life? And he says, please, you can't say my name. It comes from my brother Tahir.
Yes, so I don't think that epilepsy precludes a person from marriage. I think I'm not an alim, but the general advice would be that if a person does have epilepsy, then they should disclose this to the prospective spouse and advise them as regards to their diagnosis, that they are on treatment and what is the frequency of seizures that they are having. And then should both partners then be willing, then that would be acceptable.
Yeah, but obviously if it's an Islamic viewpoint that's required, then you should contact your local alim.
Yes, for the proper fatwa.
For the proper fatwa, yeah. Because I've read the disclaimer for the doctor. No, I haven't read an Islamic disclaimer. But yeah, inshallah, I hope all works out well. Also, Dr. Parak, why is it important to raise awareness about epilepsy? And how can we reduce any stigma around this condition?
Yes, so what is actually interesting is that the majority of patients worldwide who have epilepsy reside in the developing countries. And unfortunately, they are the ones who are more likely to not have access to treatment. And the reason that developing countries are more likely to have people with epilepsy is because of the high incidence of infections and head trauma. In South Africa, remember, we have a very high accident rate. So we have a lot of patients with head trauma. And yes, as you say, people have been stigmatized and discriminated against society, both in learning, social, as well as occupational settings. And it's important to have awareness programs, as we are having today, to inform the public that epilepsy is another brain disease, or another medical condition, as we have hypertension or diabetes. There is treatment for it. It does not mean that the person who has epilepsy is of lower intellect. So I think we need to create this awareness, remove the misconceptions. People who have epilepsy, they can excel both intellectually as well as physically, and we need to remove the biases that we have against them and encourage and allow these people to live full and active lives.
I'm going to pose the last question that's come through to you, Doctor. Assalamu alaikum. Not sure if it's related, but what causes a sudden jerk or a falling feeling when one is asleep?
So just prior to falling off to sleep, one may experience what we refer to as a hypnic jerk. This is actually physiological, nothing to worry about. It's just the body relaxing. Between a state of wakefulness and sleep, most times it's actually physiological, nothing to worry about.
Dr. Hussein Parak, Jazakallah khair for joining me on the program this evening. It's been highly informative. And thank you to all the listeners for the questions that you have posed. But Doctor, before I leave any guest, I always ask for a message for our listeners. What's your message this evening?
I think just to summarize it, epilepsy is just another medical condition. People have been stigmatized. We need to remove the stigma. We need to support these people. Where you know of people who have epilepsy, make sure that they are in the social circle and we don't just exclude them.
Jazakallah khair, Dr. Hussein Parak. Jazakallah khair for joining the program this morning. This evening. My apologies. This evening. And I want to thank all the engineers at the various radio stations that have engineered for us this evening. I want to thank the listeners for tuning to Medical Files. Medical Files will be back with you next Tuesday evening at 8 p.m. inshallah. And before I leave you, I want to say to you that may you be in the care and protection of Almighty Allah subhanahu wa ta'ala. And to really chat again for myself, Faisal MJ Sulaiman. Do enjoy the rest of your week, and Assalamu alaikum wa rahmatullahi wa barakatuh.
Dawah, Tarbiyah, and education, establishing the foundations of Islamic civilization in South Africa.
An informative Islamic global perspective. This is Al Ansar News.